Hi, Marcus Cope here, orthopaedic surgeon. Today I want to talk to you about what to expect by 6 weeks following your either hip or knee replacement. Patients always want to know what their expected recovery will be like. Obviously, it's very difficult to say what the recovery will be like for each specific person because their medical history can be very different. They may have other musculoskeletal problems, they may have back problems that limit their mobility afterwards, and obviously reduce their ability to mobilise as well as they would like. Now, this is just what the average patient would be like after surgery, and at 6 weeks, if you were a patient that only had arthritis affecting the single joint that I've operated on, I would expect if you've had a knee replacement that you would have been on crutches for between 4 and 6 weeks after the surgery, that at the 6 week mark you would be mobilising anywhere between 2 to 4 miles. You would still find that the knee would be swelling at that stage, and that the knee would be aching when you'd done a lot more exercise that day, much the same as you would be if you would start to go to the gym now and did unaccustomed exercise. Your muscles would complain a little bit the next day. The other thing that people would notice is that if they were sitting for prolonged periods of time, the knee would often be stiff when they first get up and start walking, and usually it would take 2 or 3 steps to get rid of this. That's just a brief overview of how someone with knee replacement would be after surgery. And that's as I hasten to add, the average patient. Some people will do better than that and excel. Others will be a little bit slower. Now, the key thing is not to beat yourself up if you're a bit slower. Everybody gets to the same place eventually, but some people it takes a little bit of time to get there. In relation to a hip replacement, people tend to recover quite a lot quicker than a knee replacement, because basically just building on your walking ability on a day-to-day basis builds the muscle, and we're not trying to get increased range of motion with people when they're having had their hip replacement as opposed to their knee replacement. Now, I hope you found this useful. If you have any particular questions relating to either hip or knee replacement, then feel free to pop it in the comments below, and I will attempt to answer any questions that you have. This has been Marcus Cope, orthopaedic surgeon. I work in the Northwest. My website is www.marcuscope.com.